Honored guests, colleagues, students, and friends, I want to thank you all for being here tonight. It gives me great pleasure on behalf of the Ivey Center for Health Innovation and Leadership, which we call iChill, to take the podium to fulfill a couple of roles this evening. The first is to share a few words on the strategic direction of the center, and the second is to recognize our first Jim Hatch Scholarship Award winner. So let me first talk about why I'm involved and why I've committed my time and Medtronic of Canada's resources to this center. I've been in the healthcare industry now for over 25 years, and during this time it's become clear to me that we simply need more people with an understanding of management and leadership, but also an intimate knowledge of our healthcare system. Canada needs more leaders who get business and who get healthcare. We need leaders to work at companies like mine and many others represented here tonight, but we also need them working within the public healthcare system to identify the changes that we all know are needed. We need leaders who understand that innovative new technologies, systems, and processes must be embraced in order to make the system sustainable. We need to tame the spiraling costs of healthcare by eliminating waste and promoting innovation. We need leaders who understand how to go about overturning a sometimes intractable culture and many silos with a bias against change in the healthcare system. We need leaders with a global perspective to learn from developing economies and also to assist those markets to deliver affordable care. It's an even bigger challenge sometimes in those markets. In the world of medical devices, and this is true of other life sciences as well, Canada is a relatively small market, representing, in the case of medical devices, probably less than 2% of the world market. And within that market, we have a lot of pressure to keep prices low from our capable procurement groups, but we also have to overcome high distribution costs and a very high regulatory burden, whether from Health Canada, formularies, hospital budgets, medical fee schedules, and the emerging health technology assessment sector. Yet many of these medical devices and other technologies hold at least part of the answer to challenges facing our healthcare systems. They are technologies that are helping patients live longer, more productive lives, and at home. They're technologies that allow for faster, cheaper treatment that is less invasive and less painful, maybe with less side effects and less complications. In many cases, they're technologies developed here in Canada that could and should be commercialized here, creating new high-paying jobs. And I guess I'll go way back and say that insulin came from Canada, the pacemaker came from Canada, more recently arthroscopic knee surgery, implantable loop recorders, and many, many more inventions that came from Canada but were for some reason not commercialized here. This is what the Ivey Center for Health Innovation and Leadership is working on. It is developing the leadership talent to address these challenges and engaging the scholarship to demonstrate the true economic value of new technologies, systems, and processes. This makes the center a truly unique institution in Canada, and the work we're doing is long overdue. We've needed this center for a long time, and that's why I'm supporting it and my company is supporting it. But the urgency and scope of the center's work is also its greatest challenge. The Advisory Council that Kelly mentioned earlier has given advice and direction to the center that they need to start with two things: leadership and talent development, and second, focus the scholarship, publications, and advocacy on those areas where gaps exist, where as a business school it can bring the most to the table. In other words, focus the center's efforts on where it can have the greatest bang for the buck. I applaud Kelly and her team for taking on such an ambitious agenda. I know we'll succeed because of the support of so many of you in this room and from the faculty and staff at Ivey. As an alumnus, I'm a very big believer in this school. But all of these plans require resources and funding to Delivering these programs has a cost. Lori Turek, who you heard about earlier, does a super job of keeping costs down as much as possible, but more resources are needed. So even though some have contributed generously already, the center's plans call for more, and I would urge you to consider a substantial contribution. Your sponsorship to a specific program is important, but more importantly, your sponsorship will contribute to the overall objective of developing the leadership capacity and talent our health system needs so that it can embrace innovation and drive change. That change to the culture of our health system will benefit us all in the long run, and it's why I'm excited to invest in the iChill Center.